you're not responsible for drug pricing. But I'm just wondering, what do you think about the high drug prices of the cancer drugs, of the new cancer drugs and gene therapies? Are you concerned about how society will handle it and whether people with lousy insurance won't be able to get access to the drugs?
Yeah, I'm concerned in a number of ways. I mean, as someone who, used to take care of a lot of patients, I know people who've sort of had to make the choice between their anti-fungal medicine after their bone marrow transplant or their rinse. Nobody should be forced to make these kinds of choices. And the high cost of drugs from a patient care point of view is very concerning. I also worry about the burden, it's not the FDA problem, but from a payer perspective, the CMS side, the burden of these very expensive therapies on American healthcare costs. So it's very concerning. I think it's also important to say that drugs are expensive for multiple different reasons, and they're not, and how we should feel about those groups is probably a little different. So, some drugs are very expensive, or new therapies are very expensive because they're really innovative, highly novel, new inventions, first in man kind of stuff, and that bothers me when those therapies are extremely overpriced. But it doesn't bother me as much because my sense is somebody's invented something really great, and that's good for humanity. And having a drug that works, that's expensive, is a better problem than having no drug at all. What we see in many therapeutic classes. But the other reason another reason drugs can be high is because of the sort of what Scott Gottlieb called the shenanigans. These pay for delay and patent gaming or these sort of regulatory sort of virtual monopolies that can get created. And those are areas where the FDA, frankly, has more to do. So we can try and create a regulatory pathway that prevents those things from happening. And this is, wonky but very important things like how the Orange book and the Purple book work, or our policy on 180-day exclusivity period, and these sorts of things that allow generic drugs to come to market. So in that area, I think the FDA can support these, market-based pro-competition approaches that can lead to new approvals. I think there's been a lot of success. The data in generic drugs, that's an area where the FDA has seen record approvals over the last few years, and with support from Congress, that side of the house is in better shape. Biosimilars is an area that's really developing, and it's still early days, but we're about to approve. We're over 20 now biosimilars approved, and that number is going to grow. And we just announced guidelines whereby biosimilars could become substitutable, interchangeability guidelines, which would make them even better from a perspective of driving costs down. So I think the FDA can really do some things there to make biologics and small molecule drugs available in a sort of generic or biosimilar approach.